name is Samantha Fasile, and I will be telling you about my internship over the summer with UGA's Wildlife Treatment Crew. Basically, what this crew is a team of both fourth-year vet students and staff veterinarians, and they work together to provide free medical care to wildlife species that get turned in by Good Samaritans around our community. The team is led by Dr. Divers and Dr. Meyer, and then our resident is Dr. Desprez, and she basically organized the interns to work together and be assigned by the vet students. And because this is a free service, we mostly get our donations from Good Samaritans and the Kate Grant Wildlife Fund. So basically the goals and objectives for this internship are to obviously assist our wildlife patients and interact with other interns and our supervisors, which are the fourth-year vet students. And together we would collaborate to help plan a treatment for our patients, depending on what their needs were, how bad they came in. And then once they're fully healed, we would contact a rehabber who would be available to bring them in. So the application process, I first heard about the treatment crew through the pre-vet club, and they had one of their vet students come and speak about the internship. So I was curious and interested, so I went on their website and filled out their application. It was fairly simple, and they asked me basic questions, why I wanted to be in this internship, and more importantly, when I could. The summer internship consists of 3 block schedules, mostly lasting about a couple weeks. And once you get accepted, they put you into one of those blocks. I was set in block B, so that was actually the longest block that they had that summer. And then one of the other prereqs was you have to get rabies vaccinations, which I didn't know this is like a series of 3 shots, and each shot is like $270. So it was a pretty expensive thing to do. In addition, we had to get new ID cards so that we can have access to vet school, because sometimes our patients would have to be treated overnight or like before working hours. So it was pretty expensive, but definitely the experience was worth it. So here's just a procedure of like how we kind of like ran our internship. A patient comes in from a Good Samaritan, and before they call the interns in, the vets and the vet students would evaluate the patient to make sure if they were able to actually help this animal, because again, it's a nonprofit, so if a lot of the times the patient was too ill or injured, they couldn't, save it, then it would be too much of a hassle. So once they evaluate that, they call us into the case, and we would work with whatever vet student we were assigned with to get a more complete diagnosis and design a treatment plan. And one of the biggest responsibilities that we had was to attend all of our treatments, no matter what. They also gave us the option to attend their rounds, which normally happened around 9 o'clock in the morning or later on that night. And that was usually led by the head vets, where they would discuss with the vet students about the progress of each patient. Then once about a week or 2, depending on how the progress of our patients are, we would contact rehabbers to see if we can get them discharged. And again, this is just like a more detailed outline of our daily routine. 7 a.m. would always, no matter what, be the time we had to come in every day. This is a time where we would check on the status of our patients, making sure they're being fed, that their cages are clean, their weights, seeing if they gained anything or lost anything. Then again, 9 a.m. were rotations. That was pretty cool to see, because even though we weren't in the discussion, just watching the vet students like argue their cases to the vets was pretty cool. And then again, our responsibility is to make sure our patients are being met, and a lot of the times, like depending on their needs and the intern's availability, we'd have to kind of collaborate together, making sure, because at least for me, I had summer classes at the same time, so I would be gone most of the day and had to make sure my partner was in contact with me and I with her, and we just make sure that our patient was being fed and the medicines were being given to them. So the work environment kind of varied depending on the week, on how busy we were. Like one week we had pretty much a zoo. We had a lot of patients come in, so it was very hectic. Other times it's fairly slow. The issue with our the area that we worked in was it was divided both between client patients that were owned by owners and just our patients that were found in the wild. We were not allowed to touch any of the clients' patients just because of liability issues. But the other half we were able to take care of. That picture was actually probably one of the best days of my life. It was not found by a Good Samaritan. It was, I think one of the vet students was just babysitting a sloth. But yeah, that was pretty awesome. So one of the things that I learned was a lot of medical procedures, but based on what I've learned so far at Word Now is a lot of knowledge from my vert class, and it really helped me like identify the species that would come in, especially if they were younger birds. It's hard to distinguish what species it is, and then understanding their life histories, knowing what kind of diets they have, what habitats they live in, really helped determine what kind of treatment we would give them. So definitely lack of like the medical aspect of that portion was something that I probably would have needed, but again, I haven't taken any the conservation of medicine class led by Dr. Hernandez yet, so I think by that time I'll get it. So that's it. Any questions?